Hi everyone, I'm Susan. Today we are going to talk about generalized anxiety disorder. This disorder gets its name because the anxiety is unfocused and chaotic. It manifests itself in response to various situations, for example, when someone knocks on the door, when you need to go somewhere, when the child goes to school, etc. Generalized anxiety disorder is present in our body almost 80% of the time, even at night. The disorder can prevent you from sleeping well. Generalized anxiety disorder does not let go of a person deeply and for a long time. For example, even if you sleep 8 hours, you still cannot achieve deep sleep. Instead, sleep is intermittent and shallow, with early awakenings. When anxiety becomes pathological and interferes with normal life, it becomes a disorder. In addition, our body becomes tense and reacts to anxiety with various symptoms such as endless sweating, tremors in the limbs and headaches. If the body is tense, it can trigger migraines and other pains. Man is constantly trying to control everything. He does not let any new events into life. He follows the old route, visits the same cafes, does everything the same, day after day. Everything seems to him very disturbing and dangerous, and everything looks in his eyes in dull colors. He does not feel joy in life, because for him to be joyful is extremely disturbing. It is better to be a little depressed. I would not say that this is some kind of depression, because if it is depression, then this is already an anxiety-depressive disorder. However, it is slightly present, and this bleak mood is a generalized anxiety disorder. When you ask a question and try to keep the patient in order to get some secondary benefit, this can cause anxiety in the person. He may respond that anxiety gives him the opportunity to be on alert so that he can never be taken by surprise. He is always in a fighting stance and can withstand a blow, is extremely rarely disappointed, and it is almost impossible to offend or sadden him, because he is always in this state. He kind of got himself vaccinated with generalized anxiety disorder. His anxiety keeps him and his loved ones safe until his anxiety leads to something very bad. Anxiety helps him control his entire future, and this may indeed be the case. For example, when an anxious patient is in the role of a passenger and controls the driver before driving, I remember myself. Many times I prevented possible accidents by not giving myself the opportunity to sleep restlessly. I controlled the road and reminded the driver about potholes and possible dangers. Who else did this? Who sat in the passenger seat and controlled the road in order to tell the driver in a timely manner? It turns out that this was a positive reinforcement for me, aha. While I was anxious, I really managed to avoid something negative. Yes, this actually happens, it happens time after time. And all this is nonsense. False fears and experiences. Disruption of concentration is natural when you are constantly agitated, anxious. It is difficult to focus on one thing. Let's look at the causes of generalized anxiety disorder that a person suffers from. First, organic causes should be ruled out, such as thyroid, adrenal, hormonal, or cardiovascular problems. There may also be a tumor in the brain, so before contacting a psychologist, patients undergo MRI and ultrasound to rule out a somatic component. Perhaps the organics are primary in this problem, and all these thoughts and tics are associated with physiological disorders. This is the first point to consider when diagnosing anxiety disorders. The second point is genetics. If the mother, grandmother had anxious tendencies, then the likelihood that the child will also be sensitive and impressionable is quite high. This may be due to heredity and prenatal development. Perhaps the child had some kind of pathology that affected his behavior and response to stress. Finally, social conditions, psychological trauma and various suggestions can add firewood to the fire and exacerbate anxiety. All of these factors combined can lead to generalized anxiety disorder. For example, when parents say direct or indirect words that you should not go to a certain place because it is dangerous there, this can cause anxiety and excitement in a child. Disturbing news that imposes the idea that the world is very dangerous and aggressive can also be affected. All of these can lead to neurotic conditions such as generalized anxiety disorder. People suffering from such conditions need help and psychotherapy. Important factors that can increase anxiety are laziness and endless lying. I think this quarantine has been very difficult for a lot of people. I felt very restless and worried that we couldn't do physical activity to cope with stress. But besides that, we couldn't go out and spend time with friends, so I often resorted to using my cell phone and other gadgets to entertain myself. However, this caused my body to become more and more immobilized and my anxiety, cortisol and adrenaline levels to rise. As a result, I began to suffer from an exacerbation of generalized anxiety disorder. I understand that many people may face the same problem during quarantine. To manage this, it is important to consider all the factors that may be affecting your well-being, including the medications you are taking. Some of them can cause side effects that increase anxiety. Also, it can be helpful to limit the time spent using gadgets and connect with loved ones who can be a support during difficult times. In the end, it is important to understand that anxiety and fear can create a cap that prevents you from seeing the world with clear eyes. However, if you take the necessary steps, you can reduce your anxiety levels and enjoy life. Thank you for watching. Subscribe to my channel.